afternoon, everyone. My name is Dan Hatfield, and I'm with the Coordinating Center for the National Collaborative on Child Obesity Research. It's my pleasure to welcome you to part 2 of our workshop, Obesity-Related Policy Systems and Environmental Research in the US, or OPIS. We have an amazing set of presentations and discussions coming up over the next couple of days, and I'm so pleased that we have hundreds of people from all over the US and the world joining us today. Next slide. So first, just a couple of technical details. If you're having any trouble logging into the webinar, please email us at ncor@fhi360.org, and we'll be happy to work with you to resolve the problem. If you have a question for our speakers during the webinar, please share it using the Q&A feature on the bottom of the screen. We'll relay those questions to our discussion moderators, and we'll get to those, as many of those as we can. Next slide. We'll also be tweeting today's webinar from the @NCOR Twitter. To join the conversation, please use #OPIS. Next slide. This event has been organized by the National Collaborative for Child Obesity Research, and if you aren't familiar with NCOR, we were launched in 2009 through a public-private partnership of 4 leading research funders: the National Institutes of Health, the Centers for Disease Control and Prevention, the U.S. Department of Agriculture, and the Robert Wood Johnson Foundation. Our mission is to accelerate progress in reducing childhood obesity for all children, with particular attention to high-risk populations and communities. We have a range of publicly accessible tools and resources related to child obesity and child health at our website, ncor.org, so check that out if you haven't before. And if you have any questions about NCOR, feel free to reach out to us at ncor@fhi360.org. Next slide. So next, we want to hear from all of you in the audience. Throughout the day today, we'll periodically use a platform called Mentimeter to get reactions from the audience. We're going to give that a try now with a straightforward first question. So please use your phone to scan the QR code or go to menti.com and enter the code at the top of the screen to join. All of your responses are anonymous, so we hope you'll give it a try. We'll continue to use Mentimeter throughout the day today and tomorrow to get your thoughts, so please leave the window open so you can easily navigate back to the page. So please tell us, where are you joining us from today? Great, we've got someone joining us from Chile. Great, a few folks from San Antonio. We've got Cleveland represented, Bethesda, Columbus, Wisconsin, Cleveland, Atlanta. Wonderful. North Carolina, looks like we've got a few folks from there. Howdy from Texas. Great to have you on the webinar today. Wonderful. Baltimore. Spotsylvania, Virginia. Fantastic. Really great to have such broad geographic representation on the workshop today. So I hope you will continue to engage with us through Menti throughout the course of the day today. We'll have a few additional opportunities for you all to share your thoughts. Next slide. So here's a brief overview of the core presentations you can expect to see in the workshop today and tomorrow. We'll start this afternoon with a session on planning and engaging across sectors and settings. Erin Hennessy will give our first keynote talk, and then we'll moderate a discussion with several experts on engaging communities through collaborative policy systems and environmental strategies. Then we'll have a panel discussion focused on the integration of a range of whole-of-community actors and PSE interventions. Our second session today will focus on design considerations, on how we can apply rigorous designs to evaluate PSE interventions. We'll start that session with our second keynote address from Amy Carroll Scott, and that will be followed by a set of panel presentations focused on the design, implementation, and evaluation of PSE interventions. And finally, Allison Carpin will moderate a discussion with Bill Dietz and Chris Economos with critical reflections on the future of PSE intervention methods. Next slide. Day 2 of the workshop will start at noon tomorrow and will include a session focused on adapting, scaling, and sustaining whole-of-community PSE interventions. Terry Huang will kick off that session with our keynote address, and that will be followed by 2 panels. The first will focus on approaches for ensuring PSE interventions are both locally relevant and sustainable. The second will focus on the integration of broad social drivers into PSC interventions. And then we'll end the day with a closing discussion with our 3 workshop co-chairs, Jamie Shariki, Tamara Dubowitz, and Shariki Kumanika, during which we'll aim to distill out key takeaways from the workshop and reflect on implications for where the field needs to go next. So in short, it's going to be an incredibly compelling set of presentations, and I hope you're as excited as we are to see the conversation unfold over the next couple of days. Next slide. Next, I'm so pleased to introduce Dr. Heidi Blanck, who will be sharing some welcome remarks. Dr. Blanck serves as the Chief of Community Nutrition and Obesity Prevention at the Centers for Disease Control and Prevention. In that role, Dr. Blanck supports teams focused on national and state surveillance, applied research, and technical assistance to promote health and equity through early childcare and education, healthy nutrition standards, family healthy weight programs, and food security initiatives like fruit and vegetable programs. Dr. Blanck is an active NCCOR member and served on the planning committee for part 1 of the Opus workshop series. Dr. Blanck, I will turn it over to you.
Thank you, Dan. And please let me know at any point if there's any problems with the technology, and I can go off screen. So hello and welcome everyone. Good morning and good afternoon to our NCCOR Opus workshop. As Dan said, I'm Heidi Blanck, and I'm a member of NCCOR and representing the Centers for Disease Control and Prevention. I also co-lead DNPAO's NOPRIN network. That's our Nutrition and Obesity Policy Research and Evaluation Network, which focuses on studying policy implementation and studies how policy system and environmental approaches are spread and scaled across the U.S. This includes prioritizing those interventions of CDC's programs in our REACH, HOP, and SPAN, and also programs such as USDA's. I really want to thank the NCCOR Steering Committee for their service to NCCOR, to the FHI 360 staff. Also thank the planning committee members for Opus 2, including our 3 co-chairs and our CDC members. So I'll say a shout out to Amy Warnock and Sarah Sliwa for their support. As I get started today, I also want to acknowledge the devastation and suffering that hundreds of communities and thousands of people are experiencing in the wake of climate change charged Hurricane Helene. Individuals in Florida, Georgia, Tennessee, South Carolina, and my state of North Carolina have been through a lot in the past 12 days. And we want to let them know that we acknowledge this and send our thoughts for their recovery journey. My beloved city of Asheville, North Carolina has suffered quite a bit of damage, and it's really fascinating and heartwarming to see community members coming together to address really acute food security and water security needs. As we are here today on October 9th, I know some people will come back to this webinar in the weeks and months to come as part of a taped session. But I also wanted to acknowledge today in October the health and safety of millions of people in Florida that are now at risk from Hurricane Milton, which is about to make landfall. As a retired public health service officer, when I was active duty, I served in Texas during Hurricane Rita, now almost 20 years ago. And that experience solidified for me the need for social ecological models and systems frameworks. When we think about experiencing acute issues and disasters, we often have to think about ourselves and our peers in our household. So I will really encourage folks after today's workshop to download the FEMA checklist on preparedness to make sure your house and your household can remain safe. Another thing as we think about this is the social connectedness in our local and state policies, so connecting with your neighbors. And finally, in the wake of a disaster, we also think about the larger systems and the macro environments. So for those of us who work in food systems, nutrition, obesity, and chronic disease prevention, as we think about the interventions we're going to hear about in the next couple of days, I also want to push us to think about our role, not in just human health, but in planetary health. So I'm really excited to really launch today's workshop. So next slide. So as Dan was pointing out, the real focus of our workshop is to talk about policy system and environmental approaches, or what we call PSE. I am a member of the National Academy's Roundtable on Obesity Solutions, and it's been really a great opportunity over the past 15 years to consider how we as a nation are finding interventions that work to support child obesity prevention and how we can accelerate those. But unfortunately, we still live at a time for many households where it's difficult to make a healthy choice if no healthy choice is available. And we know our obesity rates remain too high and that disparities persist. And so looking at policy systems environments, we really need to think about the various jurisdictions, so national, state, and local levels, and how PSCs address both proximal. So for example, when our children are away from our houses and spending time in childcare and schools, and then the larger distal drivers are contextual factors that impact all of us, things like poverty, education, housing, marketing of foods. So we really need to think about both of these levels if we're going to continue to reverse the high rates of child obesity. Next slide. So as Dan has pointed out, with the first workshop, we really tackled looking at the interventions that we could see happening on the ground and really exploring what kind of progress did we need in the research field to address evaluating these complex policy system and environmental approaches. Our first key learnings included methodologies used for research and evaluation and what are the needs that we have. But really for today, we're going to start looking forward. So understanding key learnings will continue. We'll explore critical methodological issues. And again, where do we have future directions for the field? Next slide. So as I look back at June, and I've had a lot of feedback related to Opus 1, there's been lots of folks thinking about the critical needs. So as someone at CDC who supports technical assistance needs of our practitioners, really thinking about research that authentically engages community partners and sector leaders, and also those frontline implementers. Are we designing interventions from policy down to the level of organizational curriculums that really think about the person who may need to implement those? Our teachers, our childcare providers, our food service directors. We have many examples of successful policy system and environmental approaches occurring across the United States. But often we have not had the ability to study the additive effects. So for example, a 4-year-old child who may be living in a household with lower income may be eligible for WIC and receiving that newer WIC package. Their household may be able to be in a state that has had, for example, a high quality access to healthcare through Medicaid expansion. Maybe there's a state ECE license that changed recently that's improving the nutrition physical activity screen time standards. And for example, maybe that state purchases a license for Go Knapsack so that the ECE centers are implementing better offerings and the teachers have curricula related to, say, physical activity supports. So for example, here, we see many ways that PSE can be occurring, but we lack sometimes the methodology to look at whether that is creating a dose enough to really reverse child obesity at the population level. And again, thinking about the social drivers, much work happened during our COVID-19 pandemic to help us think more thoroughly about issues like housing security, transportation security. How are we including these distal factors in the types of research that we're conducting? And really, because we do have a menu already of existing interventions that work. So for example, I would point people to Opus 1, where Dr. Steve Gortmaker went through the choices menu, the child obesity cost effectiveness analysis study, where we can see a whole platform of 15 or more interventions that work. How do we actually get those into more places? So how do we study policy implementation and its intent? How do we study the spreading and scaling of these interventions? So now with the advent of implementation science, how are we thinking about those frameworks and constructs? Are we thinking about acceptability to the implementer and the client? Are we looking at maintenance costs, startup cost, what the cost savings may be? When we have interventions that work, whether it's something from Community Guide, Choices, or even the SNAP-Ed Toolkit, how are we looking at adapting those? So we often talk about the need for tailoring for the subgroups that are receiving the intervention. Are we putting funding and resources and research into really studying then, does the intervention still work, right? So we've moved from effectiveness now to spread and scale. How are we sure that the tailoring has happened? So some folks call that the adaptome, looking at red, green, and yellow related to fidelity. Do we still know that that intervention is having an impact? And then policy implementation. Policy can be an intervention itself. It can be a scaler. It can be a driver or support. And so really getting nuanced around what does policy mean and what are the constructs that we need to include in our research. Next slide. So the workshop, as Dan pointed out, is going to be divided into 3 sessions. And I'm really looking forward to seeing how the panelists will address some of those key PSC intervention areas that we have need for. So we're going to cover planning and engaging across sectors and settings for PSC, applying rigorous designs to the evaluation, and then adapting, scaling, and sustaining whole of community interventions. Next slide. And as mentioned, we're really a key part to this has been our co-chairs. So Dr. Jamie Shariki from the University of Illinois Chicago School of Public Health, who works quite closely with CDC, including the work we do in Illinois related to SPAN and the work we do with PAPRIN in really looking at policies that support physical activity, transportation, and land use. Dr. Tamara Dubowitz at the University of Pittsburgh School of Public Health, who's been a leader in food environments and research related to vulnerable populations and household food security. And Dr. Shriki Kumanika from University of Pennsylvania Perelman School of Medicine, who has for decades really driven us to think about the equitable impacts of the work we're doing, really trying to think through constructs related to reach and spread, but really ensuring that those most in need have equitable considerations in the work that we do. Next slide. So I'm going to hand this over to Dr. Tamara Dubowitz, who's going to introduce our first session and panel. Thank you very much.